Shall I share?
Okay, we are live on YouTube also now. You can go ahead.
Window बंद कर. Window बंद कर. Okay. Okay, friends, welcome to this third episode of Big Q. Today, Brain Teaser in association with Ophthalmological Society of Nagpur is 1 minute. Just let me unshare this. Yeah, sorry. Sorry, there is some technical glitch here. Screen now. Right, 1 minute.
You want me to stop share?
Yeah, no, 1 minute, Sai. Don't stop sharing the screen. Yeah, okay. So friends, good evening and welcome once more. Today, Brain Teasers in association with Ophthalmological Society of Nagpur is presenting the second time Pan-India Intercollegiate Quiz, that is Big Q. So this is the signature tune of our Brain Teasers. Not just a quiz, it's an education, it's also an entertainment. It's not only stimulates your brain, but it also makes you more also entertain you at the same time. So there are big prizes at stake for all the postgraduates. And this is for Big Q, which is an all India postgraduate.
At the end of the day,
ऊपर तेरे
लकी है परफॉर्मेंस की तलवार, ऐसी दरिया है ये, रिमेम्बर कर ले, जो डूबे वो ही होता है पार। जो भी आए यहाँ पे उसको चांस एक मिलती है, हर नजर की यहाँ पे सोचो एक मंजिल ही है। मौका मिले तो खोना नहीं, ये आएगा ना ये बार बार।
Underdog can perform, so no one is less, no one is more. Fair field for every one of you to play. So friends, here we are. So once more, good evening and welcome to all participants, and my pranam to all gurus, that is mentors who have logged to today's episode. People who have joined in quite late, just this is more information for them. Brain Teaser is an online quizzing platform which was introduced 3 years back by Team Sarakshi Netrale with an aim to have an edutainment program for all ophthalmologists across the country, and has been associated with various states, national societies for their conducting their physical and virtual quizzes. Last year, we had the privilege to host for the first time in our country an all India postgraduate quiz in association with Bombay Ophthalmic Association. The second season of All India PG quiz, that is this particular season, has seen a massive participation in the form of, in the first episode, we had 573 teams participating, besides 300 plus ophthalmologists playing the quiz. We are extremely thankful and humbled by your overwhelming response. Massive participation led us to upgrading the Zoom platform to almost 1,000 participants. And now every one of us can now log in Zoom platform comfortably. As we have upgraded that next episode onwards, YouTube participation will not be considered for gaming, and all are requested to compulsorily log on to Zoom platform for being into content. This year, we have also added a new dimension to the big by having quiz are an ace quiz masters. We have the privilege of 3 quiz masters: Dr. Manisha Nada, vitreoretinal surgeon and a neuro-ophthalmologist. She's a professor at Regional Institute of Ophthalmology at Rohtak. Dr. Satyajit Sinha, an ace phaco surgeon from Patna. He is also a member of ARC West, All India Ophthalmological Society, and a dear friend of mine. He's so busy that he was in an ARC webinar till now, and now he is. Third quiz master is again an ace vitreoretinal surgeon from Kolkata, Dr. Rupak Kanti Biswas, and a dear friend of mine. Well, the brain teaser ophthalmologist who also want to stop their shoulders with diseases for comprehensive ophthalmologist in every episode, the details of which Dr. Shilpi is going to enumerate. Registered postgraduate not only becomes eligible for participation certificate, which will definitely add weightage to his CV, but also he gets an opportunity to brush his knowledge. For 6 winning teams, there are huge. We welcome all the mentors who will be the guiding force for their teams. As a token of our appreciation for the efforts, every mentor gets a surprise gift from Team Big Q, courtesy Microvisions, besides the cash prize of rupees 15,000 for every mentors from the 6 winning teams who make it into final. We are thankful to Sai Krishnan and his Numerotech for giving an efficient back of smooth for conducting this online quiz smoothly. Of course, money maketh a mayor go, and nothing is possible with financial aid. We are indebted to Micro Labs for the support, and to name a few, Mr. Ashok, Executive Vice President, and Mr. Navneet, who are really working hard to reach out to every student in every corner of our country. Here is a promo from Micro Labs. Share करावं लागेल. Yeah.
At the end of the day.
So, Micro Labs have been steadfast since last 2 seasons, 3 seasons, and all. Now I request my co-host Dr. Shilpi Narnavare to share the format of the quiz and familiarize all the participants with the rules of the game.
Good evening, friends. Welcome back to the third episode of Big Q Season 2. So again, I will tell you the rules and the format of the quiz. So this season, it is conducted every Wednesday at 8 p.m. So platform is Kahoot. Total, there will be 15 episodes. So there are 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So out of the 8 preliminary rounds, total of the best 4 performances will be considered. So if by mistake you miss any of the round, so don't worry, because you need to play minimum 4 rounds. So quarterfinals, 80 teams will qualify for the quarterfinals. And as I already told, that the 4 best performances will be taken care to qualify for the quarterfinals. And for the semifinals, we will take the 20 teams out of the 80 teams. And out of them, the 10 teams will play the finals. So quiz is to be played from the Kahoot platform. Every team needs to log in from 2 devices. First screen is a live quizzing, which will happen on the Zoom platform. For this platform, everyone's video should be on while the audio should be off. And the second screen is the Kahoot platform to answer the questions. So the mentors are requested to log in from the separate screen, and that too only on the Zoom platform. So now coming to the rules. So this we have 9 rounds in today's quiz, 6 sets of MCQs, with 5 questions in each set, 3 sets of one-liners, again 5 questions in each set. So assessment will be done on the basis of fastest finger first, and there will be no negative marking. But finally, the judges' decision will be binding for everyone. So prizes in the finals, the sixth team, the team who will be at the sixth position will carry away 5,000. The fifth team will carry away the 10,000, and in ascending order, it will be 15,000, 20,000, 30,000, and 50,000 cash prize. For the mentors, there is surprise welcome gift for everyone, and the mentors of the 6 winning teams will get 15,000 cash prize each. And for our audience who are not postgraduates, per episode, the second runner-up will get rupees 2,000, first runner-up will get 3,000, and the winner will get 5,000 rupees. And note, this is per episode. So now these are the quiz masters for today's quiz. And now I invite Dr. Satyajit Sir to take over, who is a senior interior segment consultant at ABI Institute, Patna. He has won various awards, to name some: Dr. D.K. Bose Gold Medal for the Best Scientific, ISMS's Ophthalmology Hero Award, recipient of IRSI Gold Medal Young Achievers Award. So over to you, sir.
Thank you so much, Dr. Shilpi. So I hope everybody is ready for the quiz tonight. And I'll share my screen now. Dr. Shilpi, can you see my screen?
Yes, sir.
Okay. So we'll start the first round. And I'll begin with the MCQ questions. And here comes the first question. Which of the following is not true about malignant glaucoma? Dr. Shilpi, can you hear me?
Sir, you are audible.
Okay. Which of the following is not true about malignant glaucoma? Central anterior chamber moderately deep with bowing of peripheral iris. Shallowing of the central and peripheral anterior chamber. Aggravation by the use of myotics. Or relief with cycloplegic mediatric therapy. Which of the following is not true about malignant glaucoma? And your time starts now. So I can show the answer now, Dr. Shilpi?
Yes, doctor, go ahead. Please go ahead.
Okay. So the answer to which of the thing is not true about malignant glaucoma is central anterior chamber moderately deep with the bowing of peripheral iris. That is not true about malignant glaucoma, while shallowing of the centurion and peripheral anterior chamber, aggravation by the use of myotics, and relief by cycloplegic mediatric therapy is true. So now we'll go on to the second question, as we have already lost some time in the beginning. So now the second question is, during anesthesia, which of the following is related to marked decrease in IOP? During anesthesia, which of the following is related to marked decrease in IOP? With halothane, with ketamine, with succinylcholine, or with chloral hydrate? And your time starts now. Okay, so now the time is up. And during anesthesia, which of the following is related to the marked decrease in IOP? The answer to this is, the correct answer is halothane, in which there is decrease in IOP. With ketamine, succinylcholine, and chloral hydrate, there may be a slight increase in with ketamine, it's more, but with others, there may be slight increase in IOP, while with halothane, there may be decrease in IOP. We'll go on to the third question, which comes now. Features of topiramate-induced angle closure are all except. The options are, number one, can present with impressive IOP elevation, shallowing of the anterior chamber, myopic shift, and this type of angle closure should be treated with laser iridotomy. Features of topiramate-induced angle closure are all except can present with impressive IOP elevation, shallowing of the anterior chamber, myopic shift, and this type of angle closure should be treated with laser iridotomy, and your time starts now. Okay, so time is up, and the correct answer to this is this type of angle closure should be treated with laser iridotomy. Topiramate-induced angle closure are all except this type of angle closure should be treated with laser iridotomy. And we'll go on to the next question, which is, what is true about intravitreal chemotherapy in retinoblastoma? What is true about intravitreal chemotherapy in retinoblastoma? So the options are, the most commonly used drugs are melphalan and topotecan. Following injection, the needle is withdrawn while simultaneously triple freeze thaw cryotherapy is delivered at the entry site. The measures for anti-reflux mechanism should be taken and can be given anterior chamber seeding. So what is true about intravitreal chemotherapy in retinoblastoma? And your time starts now. So the time is up, and the correct answer to this is it can be given in the anterior chamber seeding. So now the next question and the last question will be, all are signs of posterior capsule rupture during the various stages of phacoemulsification except during capsulorhexis or hydroprocedure, there is sudden shallowing of the anterior chamber. During sculpting, there is sudden deepening of the anterior chamber. During irrigation and aspiration, there is inability to aspirate the cortex. And during division, achieves occlusion well. So all are signs of posterior capsule rupture during various stages of phacoemulsification except one of these four. And your time starts now. And the correct answer to this is during division achieves occlusion well. That is the sign during PCR, during various stages of phacoemulsification, except this one, you will see all the signs in a posterior capsule rupture. So that brings us to the end of this MCQ round, and I'll now hand over to Dr. Rupak Kanti Biswas, who is a senior vitreoretinal surgeon and director of Netralayam in Kolkata. He is the first surgeon to perform ROP surgeries in Kolkata. He has performed more than 10,000 complicated retinal surgeries, and he has established multiple new VR units in different hospitals in Eastern India. And he is a recipient of the Red Buckler Award from ASCRS, Best Film Award from Euretina, and he has received the FIFA Award from AIOS and the Best Innovation Award from IZOC. At State Society, he has won multiple awards, Best Videos and KP Roy Award. He has more than 100 national and international podium presentations He has 14 published publications, peer-reviewed journals. He was the chairman of PG Education Committee. Currently, he is the joint secretary of the State Ophthalmological Society and is the overseas consultant for machine development of Otelli for Switzerland. And now I'll stop sharing and Dr. Rupak Kanti Biswas can take over.
Thank you, Dr. Satyajit Sinha, for your kind introduction. And I think the morning shows the day, so you have started it quite well. And as you all know that we have a mixture of different type of, some few of them will be very straightforward, few of them little complicated. So we'll have a mixture of questions. We'll move on to our first question. And here it is. So you can see the picture here. So it's a scoring tool. So what is this score is used for? Your options are for the perimetry test, for color vision test, for low vision test, or for haze charting. And your time starts now. Thank you. The answer is color vision test. So this is actually FM100 hue test, so which shows the actual color picture for this. So the other one is lantern test. So there are the Ishihara state is there, but that is mainly for the screening. But these are the more test when you need to differentiate for other things, different color blindness. Move on to our next. Most common cranial nerve involved in ophthalmoplegic migraine is second nerve, third nerve, fifth nerve, and sixth nerve. And your time starts now. That's absolutely fine. So we are now looking for the answer. And this is third nerve. This is a straightforward question for you all. We'll move up to next question. That is Hudson-Stally line in cornea are of which color? Number one, option A is red. Option B is yellowish red. Option C is yellowish brown, or it is completely yellow in color. Your time starts. It is actually a iron deposition on cornea, depending upon the tear film production at the older age. So the answer will be, it is yellowish brown in color. So our next question is Moorfield regression analysis on HRT shows assessment of, your options are field defects due to glaucoma, it is neuroretinal rim and disc area in glaucoma cupping with a normal data. It monitors progression in glaucoma and peripapillary changes in glaucoma. Your time starts. Good. So we'll move on to the answer part of it. So it is actually a comparison between normative data of and glaucoma patient for the neuroretinal rim and the disc area. We'll move on to our next question. A 20-year-old woman with 3 diopter glass in both eyes underwent LASIK surgery. And on very next day, she had a corneal haze and on slit lamp and pain with blurred vision. So what is most likely diagnosis is? Is an infection keratitis, diffuse lamellar keratitis, interstitial keratitis, or a disciform keratitis. And your time starts now. Okay, so we'll move on to the answer is diffuse lamellar keratitis, and you have some, a ground glass appearance of this situation, and your patient usually they have a gritty sensation. So we have this next 5 set of questions, and I will request Dr. Manisha Nada to take over. But before that, I have the privilege to introduce Dr. Nada, and she's professor and associated with Regional Institute of Ophthalmology, PGI MS, University of Health Sciences. She has an experience of more than 25 years in ophthalmology with special interest in retina, uvea, phacoemulsification, SICS, neuro-ophthalmology, including electrophysiology. And she is head retina unit of RIO Rohtak, and she is having more than 200 presentations and 50 indexed publications in international and national journals. She is right now Vice President of HOS, General Secretary of ROS, and Chief Editor of HJO, and Excellence Award from HJO. And here it is over to you, Dr. Nada.
Thank you, Dr. Rupak, for this wonderful introduction.
You have to unshare.
1 second.
Yes, ma'am, you can.
So we start with the third.
Question. Move back.
हम अनशेयर कीजिए पहले. अभी आप पहले फर्स्ट एम्प्टी स्लाइड पे जाइए.
Yeah, I think you. Yeah, correct. Make it full screen, ma'am.
Yeah, I'm doing it. The full screen.
Niche.
Ma'am, or you can slideshow, you can start.
I can't see the slideshow option here.
Slideshow animation के बाजू में. ऊपर में मैडम.
Okay.
हाँ.
Is it?
Yeah. Correct.
Can we start?
From current slide, from current slide.
Is that fine? Can you see?
Yes,
Ma'am,
ma'am.
move ahead.
Move ahead a bit.
Yeah, I'm doing it.
No, I think you need to get out of that screen. The screen means yes. Slide.
मैम स्लाइड शो पे आइए, नहीं तो आप जो नीचे अपने फोल्डर्स है ना मैम, हाँ, फ्रॉम द करंट स्लाइड, यस, फ्रॉम करंट स्लाइड मैम, हाँ,
या नीचे में मैडम अभी मॉक्सीग्राम के नीचे में फुल स्क्रीन करने का आइकॉन है। नहीं, नीचे 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 स्लाइड के नीचे में।
नीचे नहीं आ रहा यहाँ पर। It's not there. Full slide is not there.
Madam, you find that Moxygram logo, right?
Yeah, I can see.
Yeah, just below that, just bring your mouse a little downward.
Yeah.
There
Just
you
a
can
little
see a cup-like logo. Press it.
No, I think, madam, are you already on a full screen?
It is not completely full, but it is showing one single slide on my screen.
Madam, just okay. Just come down below Moxygram. Just move a little down again.
थोड़ा
Move your
नीचे।
mouse a little down. You see a small icon, something like a presentation. Yeah, just left to this. Move your mouse a little left.
Dr. Prashant, you can take this remote access from ma'am and then do it. You can request a remote access.
I have done that. If madam can accept, I'll do that.
मैडम साई को रिमोट एक्सेस दीजिए।
मैम स्टॉप शेयरिंग द स्क्रीन प्लीज।
No, don't share. Don't stop.
Yeah, correct.
दिस इज द आंसर।
Go back.
Then I do a share screen.
Yeah, please. पहले स्लाइड पे आ जाइए।
एम्प्टी स्लाइड पे आइए आपकी प्रेजेंटेशन में।
I am on the empty slide.
हाँ, करेक्ट।
अभी आप यहाँ पे नीचे जो लोगोज हैं मैम, सबसे नीचे
इसमें स्लाइड्स नहीं आ रही, स्लाइड शो वाला नहीं आ रहा ऑप्शन।
ऊपर चले जाइए स्लाइड शो में।
होम पे जाइए, आप पहले होम पे जाइए। हाँ, अभी आइए यहाँ पर नीचे स्लाइड शो का जो ऑप्शन है मैम, सबसे नीचे आइए, राइट हैंड साइड पे नीचे। हाँ, इसके थोड़ा सा लेफ्ट जाइए, लेफ्ट और लेफ्ट।
नहीं आ रहा है यहाँ पर। It is not showing. Actually, it is black screen showing remote control, annotate and pause share and all. It's not showing that.
Why shall we start from our end?
Yeah, we'll just do one last try, madam.
स्लाइड शो पे जाइए मैडम। हाँ जी,
Slide show पे तो but I don't see.
रिज्यूम स्लाइड शो पे जाइए। ये फुल स्क्रीन नहीं हो रहा है लगता।
Dr. Shilpi, can you have the slide? Can you do this?
I think we can do it anytime. नहीं, अपने को शेयर करना पड़ेगा ना।
एक बार और ट्राई कर लीजिए, उसके बाद नहीं हो तो आप ही लोग कर दीजिए।
वहां पे लगा लेना। Madam, do you want us to play at our end? If you unshare, you can.
Yeah, I'm not seeing. I'm doing
Please,
it.
yeah, I'll share the screen for you.
Ma'am's audio can be there and you can run the video.
Madam, you can play the quiz now.
Ma'am, shall I start?
Yeah.
Yeah.
So the first question is, atypical optic neuritis can present with the following clinical features except exudates, uveitis.
Apologize for having to record this presentation and send it as I was traveling, and thanks to Dr.
Satyajit sir, please mute.
Satyajit, you have to mute.
Today, I'll be making my case for
Fourth option is
surgery as a preferred choice for
bilateral visual loss.
And time starts now.
So the time starts now. So can I begin the answer now?
Yeah.
So the answer for this question is diplopia. So we know that atypical optic neuritis, it generally presents with bilateral presentation. And so the vision is decreased in both the eyes. And so there are no chances of getting diplopia. So that's the right answer. We go to the next question. All of the following are the clinical forms of RAM, that is retinal arterial macroaneurysm, except first is quiescent, first option, second is ischemic, third is exudative macroaneurysm, fourth is hemorrhagic. You have to tell except. So the answer for this question is, the right one is ischemic. The other three are the presentations, which are the clinical forms. Ischemic is just in its etiology, but the described forms are the ones which are quiescent, the first ones. Exudative is the most common chronic type. Hemorrhagic is the acute presentation of the condition and can be pre-retinal, subretinal, or it can be vitreous hemorrhage as well. So the right answer is ischemic. So we go to the next question of this round. What is true for chloroquine and hydroxychloroquine toxicity? So you have to tell what is true. First option is corneal toxicity is irreversible with cessation of therapy. Second option is molecules of chloroquine and hydroxychloroquine bind to lipofuscin at RPE without metabolic and toxic effects. Corneal verticillata is not correlated with retinal toxicity. And the last option is fovea is first to get involved in retinal toxicity. So your time starts now. So the right answer is option C, that is corneal verticillata is not correlated with retinal toxicity. It is the deposition of the drug which occurs at the basal layers of the cornea. The drug deposits are there, but they can clear with time. But retinal toxicity, it keeps increasing. And the fovea is never involved. And corneal toxicity is irreversible with cessation of therapy. It is reversible. So the right answer is corneal verticillata is not correlated with retinal toxicity. So we go to the next question. What is false regarding Vogt-Karagi-Harada syndrome, VKH syndrome? First option is prodromal phase of VKH lasts for hours to weeks. Second option is it is seen in 5th to 6th decade of life. C option, aggressive disease with subretinal fibrosis is more commonly seen in pediatric cases. And the last option is ciliary depigmentation is seen in chronic phase of VKH. So you have to tell the false. So the right answer is it is seen in 5th to 6th decade of life. That is B. We know VKH presents with two parts. It can be Vogt-Karagi or it could be Harada syndrome or a combination. So it can be complete form where both dermatological as well as neurological features are seen. It can be incomplete or it can be a suspect. In incomplete, either of the two are seen. Either it is a dermatological manifestation or it could be neurological manifestation. And it can present in various forms like acute, a prodromal phase, which is like a viral type presentation. goes to this acute phase, then is a chronic phase, and then comes the stage where we see pigmentation, poliosis, and retinal detachment, and so on and so forth. So the right question, the answer would be B. It is seen in 5th to 6th decade of life, because it is generally seen from 2nd to 4th to 5th decade. So the right answer is B. So go to the next. A child who is suffering from fever, sore throat, and lacrimation is found to have follicles in lower palpebral conjunctiva along with tender lymphadenopathy. The most probable diagnosis is first option. It is flectanular conjunctivitis, adenoviral conjunctivitis. Third is the staphylococcal conjunctivitis, and the last is trachoma. The right answer is adenoviral conjunctivitis, because follicles are getting formed and there is tenderness in the lymphadenopathy. So it is adenoviral conjunctivitis. With this, we finish the first round, and now I invite Dr. Satyajit to present his liners. 5 liners he would present.
Thank you, Dr. Manisha, for those questions. Now we'll move on to the next round, which is the one-liner round. And so we'll start now. And before I start, there's a video of my So we are grateful to Microlab for sponsoring this quiz, and we'll move on to the questions. So these are the one-liners, one-liner round. And the first question is, identify the glaucoma microstent in the image. Identify the glaucoma microstent in the image, and your time starts now. Okay, so the time is up, and the correct answer for this is hydrous. And we'll move on to the next question, which is identify the ring. Identify this ring which is there in the iris, and your time starts now. Okay, so the time is up, and this is fairly
Doctor,
simple.
hold on, doctor, please. You can reveal the answer now.
So the answer to this is the pupil expander, which is Maliguian ring, which was an easy one. And now we'll go on to the next question, which is figure A represents the corneal layers. Look carefully at the figures from B to D. Which figure represents dissect most? 3, 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. 2, 1. Figure A represents corneal layers. Look carefully at the figures from B to D. Which figure best represents dissect? And your time starts now.
Doctor, hold on, please. Yes, you can go ahead.
And the correct answer to this is D. In this figure, you can see which represents dissect. We'll go on to the next question, which is the number of points tested in Humphrey Visual Field Analysis 10-2 are how many? What are the number of points which are tested in Humphrey Visual Field Analysis 10-2? And your time starts now.
Wait.
Can go ahead.
Okay, and the correct answer to this is 68 points are tested in 10-2 in Humphrey Visual Field Analysis. We'll go on to the next question, which is identify the optical aberration in the figure. Identify the optical aberration in the figure, and your time starts now. Time is over, and the optical aberration in the figure, the correct answer is
Yes,
Shall
please
we?
go ahead.
coma. The optical aberration that you see over there is coma. And now we'll move on to Dr. Rupak Kanti Biswas, who will be doing the next round of one-liners.
Thank you, Dr. Satyajit Sinha. Am I audible?
Yes, sir.
Okay, so we'll move on to our next set of 5 questions for one-liner. Be ready, all the participants. So please identify the nodules. I will show you with my cursor. These are the nodules. Please identify the nodules. Your time starts now.
Yes, can show the answer.
Yeah. So we'll move for the answer. That is Kepi's nodule. So which is, most important sign for granulomatous uveitis. Our next one-liner, identify the lesion. This is the yellow lesion. You need to identify it, and your time starts now.
Yes, doctor.
And the answer is retinal astrocytoma. This is little different from the retinoblastoma, and you can see this, the margins will be little more elevated and more of a, calcium deposits will be there. Next question is, what is the the bandwidth for the excitation filter in fluorescent angiography? You need to mention it in nanometer. So you need to mention the figure of excitation filter in fluorescent angiography in nanometer. Your time starts now.
Can show the answer.
Yeah. So this is in the range of 490 nanometer. This is the excitation filter, and the other one is Varia filter, so which you usually around 520 to 530 range, so that the fluorescent angiography, that part gets excited, and then you get the picture of fluorescence. So next question is to fill in the blank. So in Terence marginal degeneration of cornea, dash deposition is seen. So you need to fill in the blank with a proper word. Your time starts now.
Can show the answer.
The answer is lipid deposition. So you do see lipid deposition in Terence marginal degeneration. We'll move on to next. Association of keratoconjunctivitis sicca with rheumatoid arthritis is seen in which syndrome? And your time starts now.
Hold on, doctor. Hold on, please. Yes, please go ahead.
Okay. So the answer is Sjogren syndrome. So judges to note that this spelling has to be correct for the right answer. This is a typical spelling for us. And now we will move on to our next set of question, one-liner question by Dr. Nada.
Thank you, Dr. Rupak.
Yeah, I'll just stop sharing. Yeah.
Ma'am, I'm sharing on your behalf.
Right. So all the participants, all the best for the liners. So the first liner is 100-day glaucoma is seen most commonly in which condition? So
Hold on, madam. Okay, can go ahead.
So the question is CRVO. So we know that in ischemic CRVO, in 50 to 60% of cases, we get to see this condition, that is 100-day glaucoma, which is popularly called as 100-day glaucoma, because for 3 months, the process of pus formation, that is the anterior synecdoche, keeps on going. It is from the endothelial budding, and it forms new vessels, and the angle, first it is seen in the pupil, and then it is seen in the periphery. And slowly, all the angle, it gets covered by this anterior synecdoche, and we have closure of the angle, and this is called as 100-day glaucoma. It can present with
Volume.
the next liner is name the classification based on this picture for this particular disease. The 2 words answer.
Hold on, madam. Yeah, you can go.
So you could see that keratoconus in this particular picture, along with the steepening of the cornea. You can see for there, and the answer is Amsler-Krumme. This is the classification. We can go to the next question, next liner. So please identify this disc condition. The time starts now.
It's only a 2-word answer. Participant, it's only a 2-word answer.
Yeah,
So please write only 2
2
words.
words answer.
Yeah.
Yes, go ahead, madam.
So in this picture, you could see that there is some peripapillary retinal excavation of the disc. This is a mesenchymal abnormality, which was first seen in 1970 by Kindler. So this is the morning glory. You could see that disc is of morning glory. It takes its name from a flower, that is morning glory flower. And you can see the caliber of the vessels is the same all throughout the disc. So the right answer is morning glory. We go to the next liner. So diagnose the condition which is seen bilaterally.
Go ahead, madam.
So in this picture, you could see that there is a congenital choroidal defect at the macula. And at the same time, you could see that choroidal vessels are visible along with pigmentation. So it is one types of macular coloboma, congenital macular coloboma. Other types are non-pigmented kinds, and the ones with where the vessels, abnormal vessels are there on the disc. So it is of the first type, which is more common. It is called as a pigmented coloboma. The answer is macular coloboma. Next liner, please. We go to the next liner. So this is the picture showing the endothelial corneal dystrophy. Please identify. A single word answer is required.
Go ahead, madam.
This is the specular microscopic picture of the cornea showing the Fuchs endothelial dystrophy. So have we finished? And we can now go to the last round where Dr. Satyajit will ask MCQ questions again.
Thank you, Dr. Manisha. We'd like to welcome everybody to the last round now of MCQs. So this is round 2 of the MCQ, and we'll move on to the first question. A young phakic patient with toric ICL implanted 2 weeks back was doing well. He sustained trauma 2 days back and now needs 2/3 of his original cylindrical correction. How much has his ICL rotated? So I'll repeat the question. A young phakic patient with toric ICL implanted 2 weeks back was doing well. Toric ICL. He sustained trauma 2 days back and now needs 2/3 of his original cylindrical correction. How much has his ICL rotated? 10 degrees, 20 degrees, 30 degrees, or 40 degrees? And your time starts now. And the correct answer to this is there's a rotation of 20 degrees which will need to be corrected, which was following the trauma. We'll move on to the next question, which is identify the 2 legendary ophthalmologists, mentor and mentee, in this photograph. Your options are Dr. J.H. Kratmer and Sohan Singh Hare, Dr. J.H. Kramer and Harminder Singh Dua, Stuart Duke Elder or Harminder Singh Dua, and the last option is Dr. Stuart Duke Elder or Dr. Sohan Singh Hare. And your time starts now. And the correct answer to this is Dr. Stuart Duke Elder is there on the left-hand side and Dr. Sohan Singh Hare is there on the right-hand side in this picture. 2 legendary ophthalmologists. Now your next question is, a 25-year female with SLE was advised hydroxychloroquine at dose of 5 milligram per kg body weight per day. She also had impaired renal functions with glomerular filtration rate of less than 50 milliliter per minute per 1.73 meter square. When should the screening of hydroxychloroquine toxicity begin? And your options are: screening begins as soon as the drug is started. Screening begins after 1 year of HCQ use. Screening begins after 5 years of HCQ use. Or screening begins at the discretion of the rheumatologist. And your time starts now. And the correct answer to this is screening begins after 1 year of giving HCQ, having the patient using HCQ. And now the next question is, all are true regarding CVI except CVI is visual dysfunction caused by damage, malfunctioning of retrochiasmatic visual pathways in absence of damage to the anterior visual pathway or any major ocular disease. Nystagmus is common in children with CVI. Strabismus is common in children with CVI. And better visual performance for objects in motion as compared with static objects. All are true regarding CVI except one of these. And your time starts now. And the correct answer to this is strabismus is common in children with CVI. All are true regarding CVI except that strabismus is common in children with CVI. And we'll go on to the next question, which is the last question in this round of the first part of mine. What is true regarding cataract surgery in uveitis? Typically, anterior subcapsular cataract is there, done in absence of active inflammation for 3 months without steroids. Multifocal and plate haptics ICL are also recommended in these patients. And children less than 8 years can be left aphakic. What is true regarding cataract surgery in uveitis? And your time starts now. And the correct answer to this is it should be done in patients free of active inflammation 3 months in absence of the steroid use. Even if 2 to 3 cells are there, complete absence is not possible, but 2 to 3 cells is there, then it should be done and the patient should be off inflammation. So that brings us to the end of this my part. And now I'll hand over to Dr. Rupak Kanti Biswas, who will give you the next set of questions. Thank you.
Thank you, Dr. Sinha. We'll just move on to our next. Stop share. Camera. Okay. Am I audible?
Yes, you are audible.
So is going on fine. And the next set of questions for this MCQ round is now the malignant glaucoma is most likely seen postoperatively in which of the following condition? Option A, in myopic eyes, B, in hyperopic eyes, C, in aphakic eyes, and D, in pseudophakic eyes. and your time starts now. And the answer is in hyperopic eyes, as because of the short axial length. So there is always chance of malignant glaucoma in postoperative cases. So next question is, what is Delen? And your options are A, it's the deposition of mucus on cornea. It's a localized area of corneal thinning. It's raised limbal lesion or a deposition on endothelium, on epithelium. And your option starts now. Okay. So we'll move on to the answer. This is very commonly we do see in postoperative condition as well. It's a localized area of corneal thinning. When there is an associated with any lesion, the corneal deposit, the tear film stability is, tear film becomes unstable in that area, causing the corneal thinning. This is known as Delen. Next question is, healed patch of chorioretinitis give rise to which kind of scotoma? That is, number A is absolute scotoma. Number 2, positive scotoma. Number 3 is sloping scotoma. Number 4 is negative scotoma. Or rather A, B, C, D, the options. And your time starts now. Great. So the answer here is always they form a negative scotoma in case of healed chorioretinitis patches. Next question, what is the drug of choice to treat post-YAG laser IOP rise or IOP spike, rather you should say. After YAG laser, what is the drug of choice to control the IOP spike? Timolol 0.5% twice daily, levobinolol 0.5% twice daily, apraclonidine 1% twice daily, or brimonidine 0.2% twice daily. And your time starts now. Great. Everyone is, I believe, done. So the answer here is brimonidine 0.2% twice daily, by which you can, suppress it properly. Next question is, treatment of accommodative squint is accommodative IOL. Number B is surgery. Number C, orthoptic exercises. Number C, prism correction. And your time starts now. Okay. So we'll move on to the answer of this is prism correction, but other rest options are not applicable for accommodative squint at all. And my set of questions is over. With this, I will request Dr. Manisha to take over, please, for this.
Okay. We'll share the screen. 1 minute. Madam, we are ready. Manisha ma'am.
Ma'am is not there. She's not there. ab aa gayi.
Madam.
Yeah. First question.
Yeah.
The first question is, in which disorder are these characteristic lesions seen? So the options are congenital hypertrophy of RPE, choroidal nevus, uveal melanoma, and choroidal metastasis. And starts now. So the correct answer is?
Ma'am, answer is A. It's congenital hypertrophy of RPE.
Yes, it is congenital hypertrophy of RPE. This congenital hypertrophy of RPE can be seen as a single lesion, or it could be as a group lesions. These are the ones, group lesions, which are seen as bear track appearance. It's seen unilaterally, and 3 to 30 lesions are seen at once. This is the collection of melanin at the RPE level. And the third is the one which is associated with familial polyposis, adenomatous polyposis. So this one is bear track appearance, congenital hypertrophy of RPE. So the next question is, what is the ratio of patients presenting with BRVO as compared to CRVO? Branch retinal vein occlusion to central retinal vein occlusion. First option is 1:1. Second option 6:1. 1:2. Or 1:6. So it's a simple recall question, and the answer is 6:1. Next question is, all the following statements are true for steroid responsiveness except option A, the tendency is more in primary angle closure glaucoma. B, systemic steroids are much less prone to cause increase in IOP. C, dose-dependent rise is seen in steroid responders. And last, elevation in IOP is directly proportional to the potency of steroids. Your time starts now. So the answer is A, the tendency is more in PSEG. That is wrong. It is more in open angle glaucomas, seen mostly in the young people. The next question. The most common cause of vision loss in diabetic retinopathy is macular edema, neovascular glaucoma, fractional retinal detachment, and vitreous hemorrhage. Now, the correct answer is option A, macular edema. The other three options, they go in favor of blindness in diabetic retinopathy. So the last question of this MCQ, the third episode, mean crystalline lens diameter at 3 months of age is 3 mm. It is the equatorial diameter I'm asking, 5 millimeters, 7 millimeters, or 9 millimeters? Correct answer is 7 millimeters. So at birth, we all know it is 6 millimeters, but as it grows, as the child grows, it becomes 7 mm at 3 months of age. So thank you very much for participating in this quiz.
Extra Lube tear substitute
this
is,
is
a specialized
once more
formulation
thankful to
for
Microlab
managing
for this wonderful
hyperosmolarity
initiative,
involved in
supporting
dry
us so
eye
strongly,
by providing
and all the
extra
prizes
care.
for every episode
Lubrication.
and for the grand finale
Osmo
is going to be
protection.
supported by them. Thank you, Microlab, for this. So I think it's time for us to stop sharing the screen. I welcome all the quiz masters, Shilpi, to join me for this discussion now. Can I request all the mentors to please get their video on? I see Dr. Preetam Samant, Dr. Koel, Dr. Kumidini Madam, Bindu Malini Madam, Somen Mishra Sir, Dr. Nanda Vijaya Sahu Madam, Ritesh Singhlaji, Dr. Sotapa Roy to join us. So I request the quiz masters to have a small discussion till our leaderboard emerges, who are the top 10 performers. The question today is basically look at, see Manisha Madam and Satyajit and Rupak, all these teachers, how keen are they to watch their own students? Doesn't it look their involvement and the commitment which they have for their students? It's becoming a rare entity where we see teachers so committed to their students doing well. So can we have the teachers with us or the mentors with us? Dr. Ritesh, how are you? Can you unmute yourself? Unmute yourself.
I am fine, sir. How are you?
Fine, dear. Thank you. So we have Dr. Manisha, Dr. Satyajit. Ritesh ji is waiting till so late just to see how his students are faring. What do you think?
So they are doing pretty well. And basically, they had some problem in first 2 rounds about in the one-liners. Somewhere there was a spelling mistake or something. They were having a bit of a problem.
No, we are taking care of that. Physically, we will be taking care of that, though we are sharing the leaderboard, but manually, there are certain, what happens on a Kahoot platform, there is a limitation. If it says PRASHANT Prashant, means it has to be, even if it means PRSHANT, it just spells it wrong. But we are manually helping them out later on. We will be sharing with you. We definitely understand your concern. And we have Dr. Reena Sharma, ma'am. Yes, Satyajit, you can chat. Satyajit, Rupak, and Manisha, madam, you can chat with all the mentors there. I think Manisha,
Good
madam.
evening, Dr. Reena, ma'am. Hello.
Hi.
Good evening, Dr. Manisha. Nice to see you here.
Yeah, same here. Ma'am, can you please tell us all 3 of us, where are you from? What are you doing? What is your specialty? And
I'm basically an RPC alumni. I'm presently working in UP, University of Medical Sciences at
Right.
Itawa in Uttar Pradesh.
Very
Working
nice.
as associate professor there.
Which year graduate you are, ma'am? PG?
I passed PG in 2007.
Okay.
Good. Nice to know.
Thank you, madam. Thank you. Thank you
All-
for being with us.
Yeah.
We also
Thank
have
you,
Dr.
sir.
Preetam Kumudini, madam. Can you just get your Sutapa Roy, ma'am?
Well, somehow my video is not working, you know.
Okay.
It's, so in the camera, so I can talk to you, yeah.
Yeah. So how was your experience? And how are your students doing?
Oh, my students are doing fine. Sometimes they get not a proper continuous connection with Wi-Fi. So
Correct.
last time they missed some questions. They could only attempt 17 questions. But this time I will ask them tomorrow. But they find it very good, very educative. And really it covers very good points, you know, different aspects of ophthalmology. And question standard is from simple to difficult one gradually. So it's very good quiz, I find it.
Thank you.
And would
Thank
be
you.
helping the students to
Thank you for
understand.
your kind words, ma'am.
Yeah.
I think we also have other mentors with us. Dr. Prakya, Dr. Sangeeta Thakur.
Yeah,
If you
Dr.
can
Sutapa
join
is
us.
here. Sutapa, how are you? You need to unmute yourself, Sutapa.
Yeah. You have to unmute. Please unmute yourself.
Doctors, we have the 10 teams and the 3 practitioners. Shall I share?
Please, till we have, so that we can have the PGs also to join us for a small chat. So, participants, here are the today's leaderboard, and let us see. Can I have that screen to be full? I request.
Oro Masters 2.
Is leading the table now today.
Then YEU team. Then I team. Then small EYE team. Then private practitioner, he has put his phone number. Oro Masters 1. RIO team. Then again IA team. Then VBR team. SRA and House of the Drag 2 team.
So I request these team members who are in the first leaderboard, plus the general practitioner, Mr. To join us on the Zoom platform. You will get the link and get your video on. We would definitely like to have a look at the people who are leading the leaderboard, as well as the practitioner who is at number 5. So we are definitely excited. Satyajit, क्या लगता है हम सब practitioners भी बच्चों के साथ
Tai, please let him.
पढ़ाई कर रहे हैं
हाँ, हम लोगों इनको देख के हमें कॉम्प्लेक्स आ रहा है यार.
एकदम but they are doing so well. We are very proud of them and their mentors who are doing so well, and they are dedicated for their students.
Yeah, at 9:30, 9:45 in the evening, when sharing away their family times to look at their students, how they are doing. It's a matter of definitely a great future for our country, and we see teachers as dedicated as that.
Yes.
Manisha madam, what do you think? Hello, madam, आप भी professor हो.
बिल्कुल, yes.
We really owe all our whatever we are standing, me, Satyajit, Rupak, all because of teachers like you who are committed to us, that we are standing here. So we feel great pride in having you as a faculty, as a quiz master today, as well as the teachers who are mentors who are today on a Zoom platform with us. So
Thank you so much, Dr. Prashant. Thank you so much. I think it was very interactive. It is all fun with academics. We do academics otherwise also, but having students in the quiz is really interesting.
Thank you.
It is wrecking their brains. I think it is wonderful.
So Rupak, which teacher of yours in ophthalmology you remember distinctly who made you say it was possible for you to sit on this today as a quiz master?
No doubt about it, Dr. Lingam Gopal.
Okay.
I think we all as a veterinary surgeon, we owe to him, and you will agree with me as well. Coming to this, big queue, this is really, it is, good to see that private practitioners are also equally interested, to join and participate and moving ahead. So this is something which is not into the PG. So this big queue has penetrated into the, each and every one. So that is a big success for the big queue.
Rupak, I would like to bring to your notice, Brain Teasers was started basically for general ophthalmologists across the country 4 years back. And it was basically a platform for their entertainment and all. And just you brought to notice that you got the name of Dr. Lingam Gopal. Dr. Lingam Gopal was as a special guest on one of our episode on a Teacher's Day. We had our Brain Teaser function when he paid a tribute to his teacher, Dr. Badrinath, our teacher rather, our teacher as well. So it was our great privilege to have Dr. Lingam Gopal, whom you mentioned in your prize, as a teacher who rather molded you to be as successful as you are today. Well, Satyajit, what do you think about which teacher you distinctly remember that makes you pack ahead of the pack, rather, I should say?
I would definitely remember, pay my gratitude to, and bow my head in front of Dr. Prema Padmanabhan.
Okay.
What a teacher she is, and all the learning that we have today. So many have taught us through our life. it is rather difficult to take one name. Everybody has helped us to get where we are. But I really bow my head in front of Dr. Prema Padmanabhan, who is the master and guru of cataract surgery, and she has operated on so many presidents and prime ministers. And she is such an unassuming person, such a great personality, such a great teacher, such a great human being, that I always remember her. In fact, in my hospital, in my OPD, I have a picture of her blessing me, which I have put because I remember her so fondly. But she talks very less, the interaction is very less, but the respect is so deep that I always put her in the highest regard. So do we have all the winners who have come online now?
Doctor, they are coming up, Doctor.
Okay, thank you. Where did Prashant disappear?
And a special thanks to the mentors who are actually grooming them up to or shaping them up for this kind of national and international conferences. So actually it is the support. It's not that only the teaching, it's the support which gives them the lot of boost for them, that yes, somebody is behind us, then we can fight for that. So
definitely, Dr. Rupak, it is definitely there. It says the encouragement and motivation by the mentors. Otherwise, it's not possible. Students study, but if they don't get any motivation, they cannot really do well. So it's important. As we have had our seniors, our teachers, so would they, I think, would realize later on in life, yes, it was important.
It's very true. We all have crossed this, PG days. So everyone has crossed that day. So if you go back and think, if somebody who is senior and standing by the side of you, that gives a really, really major boost for them. And that is what is exactly needed, and how actually the baton is being transferred from the one generation to the other generation.
So I'm sorry, basically we had lost the connection, some basic major network failure at our end. So yeah, I'm back. So Sai, who all have joined us today? Which are the team leaders, team members who have joined? We can interact with them one by one.
Aura Masters have joined.
So can we have the Aura Masters team to unmute as well as get the video on? Aura Masters. Hello. Who is representing Aura Masters? Hello.
Good evening, sir. Good evening, sir.
Can we have your name, dear?
My name is Dr. Geetu, sir. I'm
Okay.
Dr. Shafina.
Geetu, you were there in the one of the last episodes, correct?
Yes, sir. Last episode we were there.
So that time also you were number 1?
No, sir. That time we were 10.
Okay, so that's a good climb. Well played, well played. So
Thank you,
Satyajit, Manisha madam and Rupak, these girls were there on number 10 and episode number 2, and today they are on number 1. Well played.
Wow,
So you have a
congratulations.
Well
They
done.
need a big round of clap for them.
Congratulations.
Dr. Prashant, we can't see their faces.
Yeah, I think they have to get, I think, can we remove the leaderboard so that we can interact with them, Sai?
We can see them.
Yeah, yes, ma'am. Can you now see them on a thing?
Yeah, definitely. Yes. The bride says yes, happy faces.
Yeah.
Both Aura Masters.
Happy young girls and a beautiful girls.
Yes,
we
yes.
welcome you all, both of you. Okay. And do keep on
Thank you,
playing,
sir.
sharing with other people. So which Arvind, you are from Coimbatore, no?
Coimbatore.
Okay. I know Dr. Chandrasekhar must be your mentor. Okay. Chalo, we have Dr. Farad Fatima as well. Dr. Vijayshri, can you people join us? Somen Mishra sir is always kind and he is always there on our episode right from beginning to the last. Somen sir, he is a professor at AIMS Raipur. We also have Dr. Mary Stephen. Can we have your name, please?
Good evening, sir. Am I audible?
Yes, yes.
Yes, sir. I'm Dr. Mary Stephen. I'm the private practitioner number 89409. I'm working as senior resident in Jipmer, Pondicherry, sir. I'm doing my second year senior residency here.
Okay, so you are on number 5, correct?
No, number 2
Yes, sir.
in private practitioner.
Okay, you are number 2 on the private practitioner list. Well, you get a prize money of 3,000 rupees, and congratulations. And you're rubbing your shoulders. Rather, you dare to rub shoulders with the young guys who are reading every day in and out.
Thank you, sir.
And I respect you. Rather, I should salute your bravery or courageousness.
Thank you,
Great, well played, well played. We also have Vinith Batwani, RPC.
Sir, I was practitioner rank 2, 13th overall.
Wow, great. आप अभी क्या कर रहे हो यार? Hello?
Sir, we were just going to have a dinner.
No. No, what are you doing currently? I mean,
Sir, I am currently working as SR here in RPC.
RPC. Okay, yeah. Good. Well done. And keep playing. It will encourage us to do more better for our BQ participants as well. So thank you once more, Dr. Vinith. We have other team, we have Suyog. So can you introduce yourself?
Yes, sir. I am Dr. Suyog, junior resident in Rajrajeshwari Medical College.
Okay.
Dr. Kailash, junior resident in RRNCH, Bangalore.
Wow, great. Well played, young guys. So junior resident means which year?
The final
years.
Final years. Okay. Well played. Come on. And now we have other team.
They were at the last episode also.
Yes, sir.
This team, RR is a good college. I have gone there as an inspector. And there is a temple when you enter, and behind is the college. I was inspector there for your PGs.
Okay, that's Professor Somen Mishra from Professor and Head at AIMS Raipur. Thank you, Dr. Somen Mishra, for being with us today.
Sir, our mentor is Dr. Nanda L.
Okay. Do congratulate her. Dr. Nanda, are you there with us?
Yes, she was there.
Yes, sir. She has joined actually.
Okay. So we have Team Bhogi and Rahul. Yeah, where are you from?
Sir, I'm Dr. Shweta. We are also from RR, sir.
Rajrajeshwari Medical College.
Okay, is there any, how come all of you are together are you all seated together and playing together, the team, or you're separate?
No, sir. No, sir.
Okay.
We should not suspect those things.
I'm in a habit of pulling these guys. Okay, I know they're all intelligent, more intelligent than what our generation was, for sure. Because I think most of the questions which you 3 quiz masters asked, 99% I didn't know, and I couldn't answer none of 99% of them. Correct.
Our mentor is Dr. Satyalakshmi ma'am, sir.
Okay. Do congratulate her. Is she on the line? Madam,
Yes,
can you
sir.
join us? Dr. Satyalakshmi ma'am?
She is there. I can see her name.
Dr. Nanda?
Good evening, sir.
Oh, your team is playing so well, and why you are hiding behind? We would like to see the
Sorry,
mentor
sir.
as-
I was driving, so I didn't on it. Thank
No,
you,
no,
sir.
no. Congratulations, ma'am.
Thank you,
Your 2 teams are doing well. Same here. Dr. Nanda, are you there with us? Okay. So we have any other teams? Yeah, we have one more team, that is
RIU Rohtak.
रोहतक. मैडम, ये क्या हो रहा है गड़बड़? रोहतक की टीम आ गई है पहले 10 में.
Here also they did very well. Last time they were in first 20 something, but they are improving every time.
मैडम, the nation wants to know कि मैडम क्विज मास्टर है और रोहतक की टीम आ गई है पहले.
They are interested. They are very intelligent people.
I know.
They should be here. They should be seen here actually. The
Very
team.
good. भैया बताओ आपके बारे में.
I'm Dr. Rohan, junior resident, RIU PGMS Rohtak, and our mentor is Manish Anada ma'am.
Actually, he is in oculoplasty unit, but for particular this thing, he was my student.
भाई आपके साथ कौन है? दूसरा पार्टनर कौन है?
Dr. Surender, he's just not here right now. He's on a different line, so he's not able to join. We were doing it.
Sir, Rohtak Medical RIO, always we have students going to Prasad, my students last year also, and they had gone to the Arvind and Shankar Netralaya. So they are very bright students, sir. Dr. Rohan is a good student, sir.
Teachers, right?
Rohan, you make us proud.
I'll just rectify. Dr.
Rohan
Prasad
makes
here.
me proud every time. Every time he's got
Teachers write the destiny of their students, ma'am, and that's why we salute always the mentors like you.
I completely differ with Dr. Prashant that Dr. Manisha is having only 15 questions. So rest all 8 rounds, 9 rounds, they have to do it by themselves. And the support of Dr. Manisha, I think they will go ahead.
Yeah.
he's
Exactly.
intelligent
I'm just pulling, madam. I know the integrity of that lady who is working as a professor there. And that's why
Yes,
she's a
yes.
quiz master for today's episode as well.
Yes, we
And
have to
that's
encourage
what-
our good students. Yeah, definitely.
Of course. Most welcome. Farat Fatima, are you there with us?
Thank you, Rohan.
Thank you, ma'am.
Thank you, Rohan.
Arnav
Thank you.
Panigrahi.
Arnav Panigrahi, are you there with us?
Dr. Ritesh Singla, Dr. Sangeeta.
नहीं, रितेश सिंगला से अपन बात की है सर, तो मेंटर थे. संगीता ठाकुर
I guess there's some problem in my video.
Okay, so which team are you representing?
We are final year residents from RPC.
Okay. Who is your partner? Who is the partner in
My
crime?
partner is Ananya. Actually, she's not here right now, so we are both are joining by video conferencing.
Okay. We are missing you, but congratulations, well played, and do keep playing. And we
Thank you
would
so much.
expect more RPC teams to be a part of our Brain Teasers and Big Q. Okay, congratulations. So I think we had a chat with all of them. I believe anyone is left.
Anyone remaining? Rishita Kondru.
Rishita, can we have you on the Zoom platform with us? Tanmay Mahapatra, are you there with us?
Tanmay Mohapatra and Rishita. Rihit.
Okay, Tanmay.
Good evening, sir.
कहाँ से हो भाई?
Good. Sir, I am from Odisha, sir.
Which
And,
college?
I completed my PG from R&R Hospital in Delhi, sir.
Okay. Oji ho.
Yes, sir. Yes, sir. Earlier also.
Last year you played with us.
Yes, ma'am. Yes, ma'am.
Yes. I'm remembering his face.
या तन्मय तब आप आर में थे. अभी यहाँ पे कौन से यूनिट में आप प्लेस्ड हो?
Sir, I am presently posted in Tamil Nadu, sir.
Which place?
Near to Ooty, sir, Wellington.
Okay. We are so happy and proud to always see our Fauji bhais as means competent even in the brave part as well, and doing always serving the nation by all your sacrifices. We salute you.
Thank you, sir. Thank you so much for such entertaining and knowledge-gaining episodes, sir.
Thank you. Please. So we have there these two guys, Rishiba, and come on, introduce yourself once. You did introduce?
I'm
come
Dr.
on.
Rishita, sir, and
Hmm.
she's Dr. Babita. We are from KIMS Bangalore, sir.
So why
Third year
Babita
postgraduate.
is not speaking? Why you are all taking the onus on you to speak?
No, sir.
Very dominating, huh, Babita?
No, sir.
Okay. So, रूपक मैडम, ये बच्चों से क्या बोलना चाहते हैं? ये सब इतने बड़े बड़े होशियार बच्चे हैं, इनके सामने मुझे तो कॉम्प्लेक्स आता है. क्या भाई सत्यजीत, आपको नहीं आता है कॉम्प्लेक्स बच्चों को देख के?
बिल्कुल आता है. डॉक्टर सत्यजीत के सबको आ रहा है. They are so good. Right? कि जैसे we could not answer. अगर मैं डॉक्टर सत्यजीत या डॉक्टर रूपक के क्वेश्चंस देखती, I think I would not have answered more than 60 or 70%.
Correct.
Very right. These students are too good.
They're too good.
They are generations ahead.
Yeah.
You know what? They are generations ahead.
Yes.
Yeah, it's not only ahead, they are really brainy guys. They work hard. Unlike we people who were always a bank bencher. At least I mean that for me. Okay. So I think we had an interaction with the mentors who could come online today. We also had an interaction with the leaderboard people. So now it's time for us to conclude. So I would take this opportunity to once more thank Dr. Manisha, Dr. Rupak, Dr. Satyajit for conducting this today's third episode so well and so lucidly. And I'm sure you people must also have enjoyed, besides the students and the mentors who should have enjoyed this particular episode. So we are very proud to have you again, and thanks sincerely from the team Big Q. Now you are a part of team Big Q. We expect you to propagate this particular quiz and encourage more people so that students finally should be benefited, because it's time that we owe a commitment to students, and that was the reason why we initiated this quiz for all India level as a single platform last year, and now this is the second season. So thank you all the quiz masters. Thank you Microvision team and Sai and his numeratic team for this. So it's time to now sign off. Bye-bye everyone. We'll meet you again on coming Wednesday at 8 p.m. with the 4th episode with another set of quiz masters from our country who will be quizzing you at a different level. Thank you. Thank you everyone, and bye-bye. Goodbye.
Thank you, Dr. Shilpi. Thank you, Prashant, and thank you, Ashok.
Thank you.
It's Dr. Prashant and Shilpi. Thank you so much. Thank you.
Dr. Shilpi, a special thanks to both of you. And
Thank
thanks to my co-quiz masters.
Thank you, Sai.
Same here.
Thank you. Bye. Bye.
Bye-bye.